My name is Lydia Nyachiro, lecturer at Masinde Muliro University, and I'm going to present a paper which is already on the public, and it says critically ill patients feeding practices among nurses working in selected hospitals within Kisumu County, that is within Kenya. And I was with my co-author, that is Dr. Evelyn Morema. Now, I want to tell you about the background of this study. And as we are nurses, we know about the feeding practices that we do over to our patients while at the workplace. We get that nutritional support is ideally an important element in the care of the critically ill patients. And this is cutting across all the facilities within Kenya and globally, and it starts from the low level to the high levels. That one I mean from the dispensary, and it goes on to the national hospitals and parastatal hospitals, not forgetting the private sector. So we get that most patients who are not well fed are malnourished, and it is because of the prolongation of catabolism. Now, as we move on, we'll be able to see that is the background that I've talked about. And with poor feeding practices, we get that there's a delay in wound healing for those who have wounds, especially those who have diabetes or other comorbidities. And we'll be able to see that this starts from early age as far as weaning up to old age where we have the geriatrics. So critical illnesses cause hypocatabolism, as I've said, and that is now the build-up of what I'm saying, and it's just because of inadequate nutrition that is required. However, these nutritional needs made us study this, and we'll be able to know that the needs for our people are not yet met. A study was done in MTRH, that is Moi Teaching and Referral Hospital in Kenya, and those are the findings you are able to see there. And it's actually correlating with what we were doing. Then, because of these unmet needs for our patients, we get that nutritional needs among the critically ill patients has been associated with variations. And these variations are because of the feeding practices that we do over to our patients when they present to our hospitals. Now, we have different modes of feeding these critically ill patients. We start from the grassroots, then we go to the high levels, where we go to the high dependence units, we go to the intensive units, and we even have these patients at home. So what are you seeing from there? So this depends on the circumstances that are surrounding us when we are providing these feeding practices. So as you can see, we have enteral feeding, we have parenteral feeding, depending on where you work, the kind of patient that you are dealing with, and what you have at hand so that you can be able to provide the nutritional needs for your patients. Now, further to this, we have modifications of enteral feeding, and also the techniques we use also vary given the setup where you work in. So among these feeding practices, they vary with time as well, from a single minute, 2 weeks to years, for the duration of time that we are supposed to provide this feeding to patients, whether they are on energy tube or they are on parenteral feeds. Now, having seen these variations, when we are doing tube feeding, do you check what is already in before you start feeding? Meaning, you have to check the gastric residual volume, what is already left before you continue feeding. Otherwise, you will be able to end up with complications. Now, other practices have been obsolete. So you really have to be dynamic. As nurses, we are dynamic. Remember, you start from a low level, and then you go to the highest level. So you really have to be current on the best practices that are on board so that we are not left behind. Now, having had all that background, the problem statement, you should be able to see that we have scanty literature, and that is exactly what led us to do this kind of study. Now, we need to move a notch higher, where we need to get that you have to be ahead of what is supposed to be done. Nurse-led practices, the best practices that are on board. So you should be able to be at the forefront so that we say, yes, I'm a nurse, and I have to move ahead. I have to show the upcoming nurses of what is supposed to be done, given the experience that we have in this house. Now, having seen this, we now to do an initiative. We have to initiate the the best practices that we have to embrace in our communities, in our hospitals, so that we can be able to help our patients before they complicate or develop complications. Otherwise, it was very, very imperative for us to conduct this study, and we came out with findings. Now, the aim was to evaluate the feeding practices. The methodology was ideally a descriptive study, cross-sectional study that was done among nurses. We had 135 nurses, and this was conducted in 4 hospitals in Kisumu County. And we have various findings of this study that we came up with. Otherwise, these hospitals were purposefully selected so that we can be able to see, what are you doing in your hospital? Is it varying from the public, private, NGOs, or wherever feeding is being done? And this is exactly what we saw. Now we went to data collection. What did we do? We used a questionnaire, we used a checklist, but we were factoring in the ozone effect so that the nurses who are being observed did not know that we were observing them when they were feeding. Ideally, I was there as one of the participants so that I can be able to work with the nurses, and I was able to see exactly what was happening, and we came out with our findings, putting the p-value in place. So now these research assistants had been taken through working with them. We had the ethical considerations put in place, and all the authorities gave permission. Informed consent was also impressed, and then we had to continue with the tools that were there. Results. What were the findings? So we had to look at the mean ages of the nurses, the age difference, the young and the old. What were they doing? Looking at this, there was a significant difference in the means of ages of the nurses in the various hospitals with a p-value of 0.02. Then similarly, forms of training on the critically ill patient. Where were you trained? The background of the training that you have matters a lot with the care that you are able to give to our patients. So similarly, this is now the p-value that I was talking about. And this is what the nurses report about you feeding. These are the findings basing on the demographic characteristics per hospital. We narrowed down this. Then we also moved down basing on the parameters. What is the clinical practice on the ground? This is what we are able to see from the 4 hospitals. Now, those are the findings. I don't want to go through. We are able to see that now most of the hospitals were not checking on what is inside before they fed the patient. So the patients complicated by developing aspiration pneumonias. Now, from the discussions, what did we find? The nurses found out to be that the older, it's that they could easily imply passage time since they are pre-service trained. What do I mean? If I'm a nurse who trained in 1963, and I am a nurse who was already trained in 2020, there is a big difference in practice, in knowledge and training and everything that is there. Those were the findings. And this indicates that nurses largely depended on their pre-service training other than having continuous training. So what do I have to pass to you today? You really have to embrace yourself that you continue the journey with learning so that you are at par with the current practices so that you can be able to have better patient outcomes. Those are still the findings that are there. I want to go to the conclusion. So what did this study come up with? It came up with that feeding practices to critically ill patients among nurses needs to be up to date. How do you feed me? I am a patient in your house. How do you handle me? What are the findings? What are the outcomes? And am I proud that you gave me the best care? Are you providing quality care? And we've already seen from the other presentations, quality improvement is a journey. So can we be nurses who are leading in feeding our patients? Yes or no? You have an answer today. Those are my references, and I have a take-home message. There it is. And thank you so much for listening.